Welcome to another enlightening episode of Age to Perfection with your host, Dr. Patel, a distinguished anti-aging specialist and co-owner of the renowned RenewWellnessCenter. Today we delve into the transformative world of aesthetic lasers. With advancements in laser technology, it's now possible to achieve more precise and effective treatments than ever before. Whether you're curious about laser skin resurfacing, hair removal, or body contouring, you're about to discover how these innovative techniques can revolutionize your approach to beauty and skincare.
Hello, how are you today?
I'm good.
Okay, so today we're going to talk about lasers.
Okay.
So tell me which one you picked today.
So, one of my favorites, CAD-SAM, right? You know that I love full body blends.
Yes.
Okay, so this one I love because it's from Paso region of California.
Which is your favorite.
Yes. So it used to be Napa because I
know.
love full body CADs. And then I discovered this region and I really love it. Plus, it doesn't cost a fortune and I love to drink my red wine. And then the other thing that I really love is, so you see the gold. Plus, I just think I like things that are pretty.
I know.
And this is so pretty and I love gold, right? So this vineyard, actually, the name kind of signifies like the gold in it is if you want to do something different, then you take a different path.
Oh.
So I just kind of like the meaning. I'm cheesy like that.
No. I think you picked the perfect bottle. And here's why. Because I think we're talking today about lasers, and I think it's a path that was not chosen by everybody. And I think it's a path that you took.
Yes.
So very appropriate bottle. The reason I wanted to take the time to talk about lasers, I think, is because in your everyday, go to a grocery store and ask your average person, hey, what do you think are lasers for? What do you think a laser is? And the number one answer you're going to get is hair removal.
Yes.
Lasers are for hair removal. And I don't think people understand that there's so much out there that we do with lasers. Now, in medicine, in our training, we saw lasers in ophtho. We saw lasers in dentists use it. We see it in orthopedics. Vasculars use lasers. But I think until I got into this field, I didn't realize how significant of a field laser medicine was. So for those of you that want to know why lasers are going to be such an important part of the anti-aging process, it's because I think they do everything.
They really do. And I think we're going to a culture, which I'm really glad about, that we want to look natural. We want to age gracefully. We don't want to look different, right? Mm-hmm. And we're seeing all these photographs or images, and you'll see it pop up on your Facebook or Instagram. What did so-and-so do? She looks weird. She looks different. Okay, she got it dissolved, right? And we've been so injection happy for so many years because we want this instant gratification that even though we've had these amazing lasers, they haven't really become a focal point, which I'm so glad that they have now.
Yes.
Except in the last few years, even though we've had them, right?
Yes. And I think what we realize is, as important as Botox, the key word of the last 10 years was Botox, I think in the next 10 years, it's going to shift and it's actually going to be lasers, right? So what does the word laser stand for, right? LASER, light amplification by stimulated emission of electromagnetic radiation.
You should have a drink of wine after.
I should have a drink of wine. Why don't you explain to me what that means?
I'm like, maybe I need a drink of wine. That's a tongue twister for sure. We're just going to go with laser from here on out.
We're going to go with lasers from here on out. But when you break the actual mnemonic down, you're literally using a beam, different wavelength beams, and you are targeting something.
Right.
That's it at the end of it.
It seems so simple, but it can be very complicated. But the beauty is now we have so many different lasers that we can actually target multiple things. So what do people come in to see us for, right? Not just their wrinkles now. Mm-hmm. It's red spots, it's brown spots. And a lot of my patients come in, and probably for you too, and they're like, I didn't even know there was a laser for this.
Yes. And honestly, one of the biggest exposures and the people are seeing is now more and more awareness about lasers is coming out. Amy Schumer, her last whole stand-up comedy, the whole underlying theme was, oh, I did a laser and look, wait for it. That was her whole thing. Wait, it's going to come. The change is going to come. But I think that's been the hard part, right? So yeah. For those of you who don't know what a badass my partner is, she is not just an expert on lasers, but she actually teaches other doctors on how to use lasers, how to manipulate them, how to learn about them, and what we do. Now, as a very intelligent businesswoman, she loves her lasers and realized that she is Indian and she doesn't like to spend money.
Yeah.
And all of these lasers are in the 6-figure. Now, when I started, we had 4 lasers.
Yes.
We are at 14.
Oh, wow.
That is a lot of summer houses.
Did
we
you
have
go
sitting
through and
back.
count?
I did. I
I
did earlier.
I
today.
lost count after.
Yeah. We have 14 now. So what I'm telling you is that's 3 summer houses that are sitting in our closet.
Yeah.
So why did you, as a businesswoman,
Yes.
make that decision when everyone else was investing so heavily on injections?
Well, I think just me personally, I like that natural look. And I felt like with all the technology we have, I feel like I can do so much more with these devices. And I wanted to be able to give something to everybody, right? Every skin type, lighter skin type, darker skin type, scar tissue. I mean, I wanted to be able to treat every single person that walked through the door. And in order to do that, you have to have the different tools, right?
You do.
And it's intriguing. I mean, I think this is so fascinating. Laser technology to me is very intriguing. Like, I mean, the fact that somebody sits back there and can dissect that, like a 1726 targets sebaceous glands
And only fat and not water. And
exactly, like all these different targets. And so now we have an acne laser, we have pigment laser, we have vascular lasers, right? We have resurfacing lasers.
we have lasers that do lifting and tightening,
Surgical
and smoothing.
treatments. I mean, all kinds of different things. So I think it's just such an amazing technology and science, and you can do so much more than you can with a needle.
To me, I think your brilliant stroke was the forethought to see that, hey, lasers are going to be that avenue for non-surgical treatments, which are gaining more and more popularity, right?
Definitely.
Nobody wants to be cut open.
Yeah.
And with the desire to not be cut open, I feel like it's also driving our industry to go and explore, like you said, who's sitting back there thinking of it? Well, somebody that wants to make a lot of money.
Well, for sure. And I think the thing is, like, there's so many different lasers now from when it first started with the ruby red laser
Yes.
to now where we are.
Mm-hmm.
I mean, we have surgeons that can do blepharoplasties for the eyelids with a laser, right? I mean, you and I can do things that are non-invasive, minimally invasive with no downtime for a laser. So just being able to keep up with the technology and the trends and to give our patients the ability to come in here in a 15-minute to 30-minute treatment and then in a few months look amazing, that's huge. Why wouldn't you, right? Nobody has the time to sit at home and be covered up for 2 or 3 weeks.
That's true. So when we talk about lasers, what is the purpose of these lasers? We talked about them targeting different problems, targeting different things. At the end of the day, when you get down to the medicine and the science of it, we are on purpose causing a injury, right? We call it a controlled injury. And so I think one of the bad reputations that lasers get is,
Yeah, you hear it all the time, like, oh my God, it's going to burn my face. Oh my God, I saw it. Well, and we also have the World Wide Web. It's amazing. Google is our best friend and our worst enemy, right? I mean, because there's so many things. And I always tell people, look, people put things out, in my opinion, that are unhappy. But the happy people don't always tell us that they're happy. They go about their happy lives and nothing shows up on the World Wide Web. We don't get to see that. We only see the
miserable people.
Yeah, so that gets a bad rap of like something, right? And I do feel very strongly that knowing what I know now 13 years later after operating these devices, and maybe I was admittedly a little naive back in 2011, where these are devices that you really have to know a lot about.
You
right?
do.
You have to know how to operate them. You know how to be safe with them. And if you go to the right places, these are amazing devices that can solve a lot of different problems. So yes, I think they're gaining a lot of popularity and they can cover so many different things. So you're right. It's not just hair removal, right? It's not hair removal anymore. Although that is still number one, isn't it?
It is. It is still the number one. So when we talk about let's talk about the role that lasers are now playing, at least in our office.
Yeah.
Maybe not other places, but I think our office, we do a little bit of a different spin on things, right? Where do you feel like lasers fall into our office?
Oh, they're our bread and butter. You know that. That's why we have 14. I mean, that's the first thing I'm going to tell my patient is here's what we need to do. Any concern they have, even if it is really solvable with Botox, it's temporary. Not building any collagen. Yeah,
I was waiting for that one. I was waiting for that word.
You're like, I'm waiting for that word. It's temporary. So for example, I had this conversation with a patient today. Okay. She's 47, right? Our skin type. And I've known her for a number of years. Okay. And I don't know why patients do this. They wait for it. They wait for the change. I want to encourage everybody to be proactive and preventative. And so every time, and I'm not trying to toot my own horn, but every time my friends see me that are in the same age bracket as I am, they're like, why do you keep looking better
and better? Yes.
And I'm like, you know what I do for a living, right? You understand that, this is what I do. And here's the thing.
That's the goal. We're trying to age to perfection.
So I don't have filler in my face. You know that, right? I do lasers.
I do your face.
Yes, I do laser treatments. I do. And the goal is to build collagen.
Yes.
We started losing it when we couldn't see it. And now we see it. And sometimes it's not that it's too late. It's that you need to get started. What are we waiting for? Right?
Well, and that's the thing. Like the way I explain it to my patients is, look, why do you want to wait until you weigh 300 pounds then to go and lose it?
Right.
To me, I feel like your Botox and your fillers, they're your instant gratification, where your lasers, that's your long-term investment. Like if you want a 6-pack at 50, you cannot start working out at 48 and expect a 6-pack at 50. You have to keep up.
Why not? Why not? You know why I'm saying that?
Yes.
Because we have TrueFlex.
Yes. I know. Hold on. I just realized I locked myself at the
Yeah, you did. I did. Like, we have a device for that too.
But my point is, if you're healthy and you're able to work out and be healthy at 30,
sure,
and you keep going to the gym, then guess what? That's a lot less work you have to put in between 48 to 50.
Right.
A lot less money. Those flex treatments are not cheap.
Hey, you can do it one way, you can do the other. There's how many ways to skin a cat? So many. So.
Which is why we have 14 devices.
Exactly.
Okay?
Exactly. You do it multiple ways. But yes, I agree.
So I think, and so this weekend, we were speaking at a conference, and our audience was our peers, people that do this day in and day out. And I think a lot of people asked me, hey, I love these machines. I believe in them. I've seen great results. But one of the biggest problems that people in our profession have is convincing patients to be patient with the lasers.
Correct. Yeah.
Right. So to me, if I'm coming into your office and I want, I have acne scars. Yeah. All right. And I did when we started. I need to get rid of these acne scars. But one secret RF treatment is going to be, depending on what area of the country you are, anywhere between $800 to $1,500.
Right.
Whereas I could spend that money on 2 to 3 syringes of filler, and you could inject it all over my face, and I could look beautiful, and I could be so, so, so happy walking out of it.
But then it goes away, and you haven't boosted any collagen. And to some degree, it's also temporary. I mean,
so how do you fight that human nature?
I think it's just education, talking to your patient, making them understand and understanding their standpoint, right? And I think there's a balance too. Like, I feel like when I go into my consultations, I'm reading the patient. I'm trying to see, do they want an instant gratification? Are they able to be that patient person? If they're not, you can give a little combination.
Yes.
And that's where we talk about combination therapy is absolutely key, right? You can give them a quick fix, but then continue to work on them in the long term, right? And I tell them that. I'm like, that's fine. We're going to do a little bit of both of these, and you just have to educate.
And that's that balance of both the instant gratification with the long-term benefits.
But at the same time, I truly believe that I can give instant gratification with my lasers. And so it depends on which one, right? That's the beauty of having 14 devices.
Okay.
We can customize it.
Okay, so let's break those lasers down. Your instant gratification versus your long-term work. Sure. So when we talk about lasers, there's over 300 different companies and makes and models, and I can go on Alibaba and order,
We're not
going to, but
it's not.
There's so much out there. So when I think of lasers and when I talk to my patients, my patients tell me, well, how much downtime? Why is this downtime less? Why is this downtime more? And so I tell them, I'm like, there's your medium strength lasers, and then there's your really aggressive lasers.
Right.
Your medium strength lasers, I think of your IPL. I think of your laser genesis, right? Your little small global little vascular treatments. Those mild lasers, they have 2 to 3 days of downtime. This, I feel, is your instant gratification.
As far as the medium, like your laser,
yes,
it is you're right. It is your instant gratification, and that's what I mean is you can pair it with it, right? So we can always do kind of, and that's the beauty of combination therapy is you can always have them come back for that heavier laser, or you can do multiple medium lighter lasers, and we've seen the amazing results of that.
Yes,
patients that don't want to have any downtime, right? So there's such a
variety.
I feel like there's something for everybody, and that's what I tell everyone, right? Like even the young woman I was talking about today, I gave her the options. You to go nice, strong, and we can, she works out of the country half the time.
So she doesn't have a week to sit at home and look crazy.
Well, nor does she have the ability to come see me every month, right? For the next 12 months. So what does that look like? Okay, well, if I could get you here every single month, then I would opt to do this, but I can't. So you want to work on your neck, right? She works on a computer constantly.
So she's doing this.
So she's doing this the whole time. And her necklines are very, very, and it's funny, she noticed them and I noticed them, right? So I'm going to do therapy on her and Opus. Right. So I'm going to do a little resurfacing, but I told her one is going to have downtime, one isn't. So you can always do a little combination.
I'm glad you brought up those two machines.
And technically they're not even lasers, but
technically they're not.
Technically they're not devices, but
they're device. And you know what? Let's back up and use energy devices. How about that?
Perfect.
Energy devices. So let me explain to you guys why she picked Alt Therapy and Opus, because we have two different layers of collagen that we work on. And I always tell my patients, like, there's a deeper layer of collagen. That's your framework that holds all of the skin up. And then there's your superficial layer of collagen that, you know, when you smile, gives you those little accordion lines and, you know, that crepiness that you see visibly in your makeup, right?
The part that bothers them.
The part that bothers them. And so what she did was Alt Therapy, you can actually technically can get down.
Totally. Yeah.
You can do this, all the layers with Alt Therapy, but I'm guessing what you're going to do is you're going to really target her deep layer of collagen to really give her that
a neck
lift. Almost. And then you're going to go over, and I call Opus, I call my iron. Yeah. This is what I use to iron out my linens and my silks.
Exactly.
So the linen and the silk lives up top. And so you're going to kind of go in and smooth both of those out. Now, the other thing is Alt Therapy has 0 downtime.
Correct.
So she can do that in the middle of a work week if she during her lunch break, and then we can plan for Opus when she has.
But even then, it's on her neck and it's radio frequency, and we're in Texas, right? So it's summertime right now. So I'm like, that's a safe treatment to do for her, and it's on her neck. So if she needed to wear a little high scoop T-shirt or something, she absolutely could.
So my point with all of this is, I don't think people realize how much and how diverse lasers can actually get. So for these, they weren't even for pigmentation. They were actually for lifting and tightening, which in 15 years ago, we would have gone to a plastic surgeon. Because that was our only option, was a plastic surgeon to come and do a little nip check. Speaking of Alt Therapy, so I think Alt Therapy is a great example of devices that make people question energy-based devices. And the reason I bring that up is because
I know where you're going.
And it's okay. So even our plastic surgeons, right? They're like, really? Do you really like the Alt Therapy? I've had plastic surgeons ask me that.
Does it work?
Does it really work?
It really works.
And it's like, well, I know your knife works a lot better, a lot better than my Alt Therapy device does.
But there's no knife, there's no anesthesia, right?
And there's a whole population of people that don't want to see you.
Yeah, exactly. I mean, really. But it gives options.
Like you said earlier in the podcast, why do they wait? Why do they wait until, if you already have a turkey neck and your skin is down to here, no amount of Alt Therapy is actually going to.
Well, and you have to pick the right candidate. You bring up a good point. Like, we're not sitting here saying these devices are for every single person. There's always a time and a place for those things, right? You're right. Like, if you've already waited that long, but if you start early on, you can really prevent that from happening.
And I think that's the place for lasers. We all talk about preventive Botox and baby Botox. I want everybody in the world to start talking about preventive lasers. Yeah. So in the next 10 years, guys, this is our goal for whoever's listening. We're gonna make this trend stick. We're gonna do preventive lasers because we need to realize that this is your long-term investment.
Yeah,
this is your 401k.
Yeah, absolutely.
This is your 401k. Okay, so when we talk about lasers, and we talked about mild lasers versus intense lasers, let's talk about when to start lasers. At what age?
Well, I can tell you personally, I started when I was 32. 32.
I'm going to disagree. I think we did your 16-year-old, 15-year-old daughter a few years ago.
That's true. So I started when I was 30.
So I
got my laser hair removal when I was 16.
That's true. Well, where I was going with it is so the other thing with lasers and the reputation lasers get is you have to wait till you're old. It's for old people to go and do, because after hair removal, what was the most commonly known laser? CO2 was a Fraxel, right? Like, you go in, you come out looking like a burn victim, you sit at home for 30 days, and then you look 10 years younger. which is the goal for everything. That's the gold standard. And all these new lasers, that's where we're coming for, right? But now we have lasers for our 13, 14-year-olds, and they're for acne.
Yes.
And they are for scarring, and they are for pigmentation. And we are using it on kids.
Yeah. For a lot of different reasons, right? Your port wine stains, hemangiomas, anything.
Anything that's embarrassing as you're in your teenage years. So
low self-esteem. I mean, all these things can be corrected.
So let's talk about acne lasers. This is that new technology coming out, right? So what I want our viewers and listeners to realize is if you have a problem, go look for it. Go research it and see, because there is a solution that's a non-invasive solution that's out there. So one of the recent devices we brought in was the iykyk. You mentioned the 1726. Somebody sat in a dark room somewhere and was like, let me figure this out, because so it's going to replace Accutane if it hasn't 50% already been there.
And it doesn't have side effects.
2 months ago, I had a patient come in. She was 22 years old. She did Accutane because she had severe pustular acne, got onto Accutane, totally dried out her eyes, gave her blurry vision, and she's already had to have 2 surgeries because of the side effects of Accutane.
Yeah.
I know we love our Accutane. And I'm going to tell you this, your daughter is on Accutane.
And it is. She is, because she was not patient. Teenagers are not patient.
How did you navigate that situation? And where's
decision making? It's difficult, right? It's difficult because you're talking to a teenage girl. And so when you're talking to
I don't think that changes at your age either.
Well, I think it's just whenever there's acne and it's self-esteem and you don't, right? I mean, you just don't want to go out in public. It's life-changing. And granted, I think a lot of the root causes of people's acne is obviously different. We know that, right? I mean, teenage acne versus adult acne, male acne versus female acne. There's so many different reasons we can have acne.
I mean, we'll do a whole other podcast
on acne. The reason we have iykyk is because we wanted to give people the ability to help their acne.
Solution.
Yes. With Accutane-like results, right?
Yes.
Which it has. And we've had the teenagers do it. My child just did not want to wait for her results. Right? So we have this 15, 16-year-old girl who's, in her stages of where she wants to be social and go out with her friends, and she's feeling self-conscious, right? There you have it. But I love iykyk, and I love the fact that we have that option, because I think a lot of parents are thankful for it. I mean, who wants to go take a lab test and a pregnancy test and all this other stuff every month?
Nobody. And I think that's a good point you bring up, is lasers are now replacing so many other things. Like we're replacing like Accutane, internal, and before Accutane, there was only antibiotics, which means you're taking antibiotics, you're killing your gut, and that's it, right?
Yeah.
So same thing with when we talk about lasers for lightening, brightening, right? Before we only had, our last podcast was skincare. And we talked about bleaching creams and lightening creams. So now we're talking about lasers that address pigmentation. Yeah. Way back when, if you have melasma and your face is completely, 3 different skin tones and you can see it, no amount of makeup even remotely covers it. Now we have other options for it. Yeah. So there's newer technology. Tell me about some of the pigment technology that people might not know.
I mean, our go-to
I don't need to bleach the shit out of my skin.
Yeah. I mean, I think our go-to is Pico, right? Because Pico energy is going to help break up the pigmentation. We traditionally thought about it as a tattoo laser, and it is a tattoo laser. And what is tattoo? It's pigment. So that's our go-to. If we're specifically talking about melasma. Now, I love a good old-fashioned IPL photofacial treatment. I mean, for those gnarly brown spots. But we have 14 devices. So we're fortunate that we can use our 755, we can use our 532, we can use our 1064. There's like 4 or 5 different devices that can hit any type of pigment you have.
Okay, guys, she rattled off like a lot of numbers. And I understood all of those numbers because
basically
I went through a lot of laser physics classes.
Yeah.
But for those people that have not done all the laser physics courses that we have
the tools.
Let's break down these numbers.
Yeah. So we have the tools to target sun damage. We have the tools to target melasma. We have the tools to target little DPNs, they call them deep dysplastic nevi, those little skin tags kind of things. Oh, seborrheic keratoses. As we get older, we get those brown spots that have a little bit of raised texture to them. Those can be lasered off, especially if they're deeper and a little bit larger and round. And I will tell you, Everybody is bothered by those, okay? My patients were in their 30s, 40s, 50s, 60s, 70s. My oldest patient is 78 and they do not like brown spots on their face. And I don't blame them.
Nobody likes brown spots on their face. But, you know, here's the thing. Even with, for those of you that don't know these numbers, I think you should at least make yourself familiar with the general terms and what they mean, because lasers get a bad reputation if you don't know which type of laser is right for you. And that's where these numbers come in. You don't need to know the science that I know behind it, because my job is to color outside the lines, as I call it. But for those of you that are darker skin types, even my fair skin types, right? You want to know 532 means that it's a superficial laser. It's going to target those browns and reds. So if you're a darker skin type, you don't want to use that laser. You want to know that a 1064 is right for me because it penetrates a little bit deeper. So to me, I feel like you don't need to learn all the aesthetics and everything behind it. But my message to all of my listeners is find out your skin type. Find out which lasers can work for your skin type, which is honestly a simple Google search, right? And then find the place that works for you. Make sure they actually have the laser that you need. Make sure whoever is working that laser knows a little something about laser physics.
Yeah, they understand how to operate it.
And they know how to operate it. And number 3, be educated in what you should expect post and what you should be doing pre. I think that's where complications happen, because those are the 3 things that people feel like people miss the boat and don't educate. And usually complications happen because of one of those 3.
I agree with you. It's usually the pre and the post. Like
it's usually people that don't know what they're doing that are doing the treatments, right? Like I said, I can go on Alibaba and buy a machine. And in fact, I had a patient 6 or 7 months ago tell me their esthetician did an IPL on them. Mind you, she was my skin type.
Yeah, how'd that go?
It didn't, which is why she was here for me to remove the marks off of her face. So I think lasers are wonderful. They're amazing. And I think they're going to change the aesthetic world. And I think the way to age well is lasers,
for sure,
as long as we're smart about them. As long as the consumer is smart about them. Yeah? Okay. All right. Cheers to our next laser. What are we buying next?
Cheers. Oh my gosh. I already have one in mind. I'll let you know next. Cheers.
Cheers.
Thank you for joining this episode of Age to Perfection. We hope you learned a lot of insight on the wonderful world of lasers and how they can help your aesthetic and anti-aging journey. Don't forget to subscribe to our podcast for more expert advice and cutting-edge information on how to live your best life at any age. Join us next time as we discuss melasma and all the ways that you can combat it. Until then, stay radiant with all of the wonderful laser technologies out there.